So let me just start by saying, in less than a month, in the middle of this global pandemic, 23 million Americans could lose health care. Over 130 million Americans could be denied coverage or charged more for pre-existing conditions. So if you've got high blood pressure or diabetes or asthma, for people who are obese or suffer from some sort of chronic illness, and of course for anyone who's had a cancer diagnosis, and now for people who may have had the coronavirus, those adults would be subject to the denial of coverage or higher premiums the way it used to be before the Affordable Care Act. 12 million adults who are on Medicaid could lose access to their health care. 2 million young people who are on their parents' plans right now up to age 26 could be kicked off those family plans. 800,000 people on Medicaid who are getting help right now with their opioid addiction through Medicaid programs could lose out on that treatment. I can tell you right now in the Hudson Valley, that's how we fight the opioid epidemic, is expanded Medicaid. Well, the most important thing is that we would have to pass federal legislation that would replace all of the patient protections and healthcare insurance subsidies that people currently depend on. So we would have to immediately pass new legislation that fit whatever technical concerns the court identified, so that we made sure people continue to have health insurance and that people continue to have the ability to afford health insurance, and that people with pre-existing conditions don't lose coverage because insurance companies don't want to cover them. Since the Affordable Care Act was passed into law in 2010, my Republican colleagues on the other side of the aisle have attempted repeatedly to kill it. They've failed in the Congress, but 100 times attempted to repeal it. 100 times they've attempted to repeal the Affordable Care Act. You all remember the famous moment when John McCain gave the thumbs down and saved the Affordable Care Act. They came this close just a couple years ago. But having failed in the Congress, they've now moved to the courts. And on November 10th, the Supreme Court of the United States is going to hear a challenge to the Affordable Care Act that is being championed by the Trump administration and 18 Republican attorneys general. And my colleagues in the House of Representatives used to be using American tax dollars to fund that litigation, or their support of it. And that case could overturn the Affordable Care Act. I don't think people realize that right now the Supreme Court could throw out the entire Affordable Care Act. There are 3.2 million people here in New York who will lose their access to quality, affordable health care if the Affordable Care Act is overturned. 8.3 million New Yorkers have pre-existing conditions, and they can see their coverage denied or their costs skyrocket. Short of that, I hope we win the court case at the Supreme Court, and then we can get back to work trying to improve the Affordable Care Act by lowering the amount people pay for their health insurance premiums. We can do that by dramatically lowering what people pay for prescription drugs, by making the big drug companies negotiate the prices in the Medicare program. We've got a plan to do that. That would be a big help to people. And that's what victory looks like, is continuing to expand coverage, lower costs, give people better access to quality care that they can afford.
On January 14th, 2014, I twisted my ankle on black ice and I literally broke my foot off of my leg. I spent the next 2 months on my back with my foot elevated above my heart. I spent the third month in rehab. This is after multiple surgeries. I work as a waitress. It's a job that I love, but it has its drawbacks. One of them is that there are no benefits. There's no sick pay, there's no vacation pay, there's no medical insurance usually included in that job. So I've always paid for my own medical insurance out of my own pocket. The year that this happened was the year the Affordable Care Act was enacted and the website kept crashing. So I managed to log in and register my information with the marketplace in Albany, but I hadn't actually picked out a plan and paid my premium. By the time I did pick out a plan and paid my premium, the deadline had passed, and they said that I wouldn't be covered for the month of January, but it would be starting on February 1st. And of course, January is when I had this horrible accident. So because of the glitch with the website, my insurance company, though, agreed to push the deadline back so that my claim would be retroactivated, but the New York marketplace said no, because I had missed the deadline. So I had nothing but time on my hands. I decided to call every congressman, every representative, every senator I could get my hands on. And Patrick Maloney is the only one that stepped up to help me. And Maria and Gracia here in Newburgh. If it weren't for them, I would probably be in medical debt now and for years to come, or longer. Afterwards, I told Maria if there was anything I could ever do to let the public know how important Congressman Maloney's work is to them, to me, the little people, to please let me have a chance to tell the story. In the year 2000, I was diagnosed with a stage 3 breast cancer. After multiple surgeries, followed by months of chemotherapy and then radiation, I'm grateful to say that I'm still alive. I'm one of the survivors. Last fall, it came back. So I had surgery in October. I finally finished my radiation treatments this February. I'm now taking an oral form of chemotherapy. I take it every day. I'll be taking this every day for the next 2 years, hopefully not longer. I'm at a high risk for recurrence. If cancer survivors are denied medical coverage because they once fought this disease and won, then it does reoccur. They'll be spending not hundreds, but they'll be spending thousands and possibly tens of thousands of dollars out of their own pocket to strive to stay alive. And I hope with all my heart that this is not going to happen. And thank you so much for giving me the opportunity to talk to you today. I think I'm just probably one of many that have a story to tell, and they don't always have the opportunity to tell it.
Well, first, thank you so much for sharing your story, which is repeated every day throughout this country. And I'd like to thank our congressman for his unyielding support of not just some people, but all people, which is why we're here today to talk about a piece of legislation that for the first time leveled the playing field for all individuals to access care. If you've ever heard me speak, you know that I say one thing, that health care is a right and not a privilege. It is part of our DNA. When the Affordable Care Act was approved in 2010, nearly 1 million New Yorkers were able to access an insurance plan that would let them get the health care that they needed. Today, 1.4 million New Yorkers are still without that care, many of them being undocumented workers because they are ineligible for the care under the ACA. I could rattle off a lot about the ACA and the legislation, but there's only 2 things I want you to remember. The ACA made health care insurance available to more people, and the investment of that ACA in our communities saved lives. It is important to understand that a piece of legislation is just that. It's a piece of paper. But what that piece of paper does to someone's life, you just heard what it does. Is it fair for someone to have to make a decision to buy food or to go to the doctor? In the United States of America, it should not be that way. Is it fair to say that someone with a pre-existing condition should be denied access to health care because of limited health insurance? My husband is a cancer survivor, which means he has a pre-existing condition. Today, we have no trouble getting health insurance, but without the ACA, he would be denied. I am an asthmatic. I have a pre-existing condition, which means without the ACA, I would be denied the ability to get health insurance at a reasonable cost. Discriminating against individuals because of a pre-existing condition is unthinkable in this country. How many people would have to put off going to the doctor? How many cancers would go undetected? How many hemoglobin A1Cs would not be controlled, which would result in someone losing their eyesight or perhaps losing a toe to gangrene? How many people's lives would be disrupted should the ACA be repealed in any form? Right across the street over there is our substance abuse program, our medication-assisted treatment program. Over 600 lives are affected every day by being able to go back to work and be part of their families. In this building, along with all of our other sites, more than 48,000 people come here for their care. And since 1967, not one has ever been denied access because they could not afford to pay for it. What made us able to do a MAT program and to get involved very heavily in mental health is provided the resources because of an insurance plan. We were able to bill someone. Taking the ACA away from the patients would impact our ability to provide the comprehensive care that every person is entitled to. Just because someone doesn't have health insurance doesn't mean they don't get care. They get care at the worst time, when they're sick, when they're dying, and in the most expensive portal in the healthcare delivery system, the hospital. What we do in connection to the ACA is to keep people healthy, identify disease early, manage that disease so that the cost of care becomes reduced. The ACA is not just a program for poor people. It is a program for all people. Because as all of us know, denying access into the healthcare delivery system is short of criminal. People's lives depend on it. Your life depended on it. My life depends on it. My husband's life depends on it. Even though he's 9 years cancer-free, we still go for the test. I still be worried. I still pray. And thank God he's still fine.